Hi, I'm Dr. P.K. Talwar, cosmetic surgeon, New Delhi, and I'm practicing cosmetic surgery for more than 30 years now. Previously, I was attached to Apollo and Max hospitals, and now I'm running my own cosmetic laser surgery center at Greater Kailash Part 1, New Delhi. Today's topic is who should get rhinoplasty done, because this is something a lot of patients ask us whether I am fit for rhinoplasty, whether I should get it done or not. So we can divide them in many categories. First of all is, suppose there is some defect since birth. If your nose is not beautiful and you always felt that my nose is not beautiful, I should get a more beautiful nose, I deserve a more beautiful nose, so yes, then you are the right candidate for rhinoplasty, provided you have completed the age of 17 to 18 years. That is the time we prefer that your growth is complete, you are mature enough to understand the procedure, and then we can plan surgery for you, and you will also understand the pros and cons of the rhinoplasty surgery. So I think that is one criteria which we should always remember. Then there can be some congenital defects also, like cleft lip nose deformity. Now you are born with a deformity in which your lips are cut, the nose is deformed, and in this you get multiple surgeries done at different ages. You get your cleft lip repaired earlier, then palate repaired, and then last at the age of 17 to 18 years your rhinoplasty is done to give you a better shape, better nose. So that is I think second category which you should be aware. Then is there any trauma? Suppose your nose gets deformed because of accidents. Yes, I think that is the time you should get it restored to its normal shape. You should go to the surgeon who will try to restore it to the normal shape, because we cannot guarantee that whatever God had given you, we will be able to achieve it. But yes, we try to give you a nose which is as normal as possible. So that is the third criteria. Then you should be mentally stable. Now what I mean to say mentally stable means that you should be mature enough to understand the intricacies of rhinoplasty. Your expectations from the surgery should be realistic. Now suppose you say your nose is very thick, you are thick skinned, and then you say no, I want to get a nose like Hrithik Roshan. It may not be possible, because no two faces are similar, no two noses are similar. So your expectations should be realistic. So doctor will always see that whether whatever he is trying to convey to you, that whatever result he is trying to promise, or that he will get it for you, you should whether you are accepting that or not, whether you are understanding that yes, nothing more can be done, or this is the ideal thing which can be achieved. So that is another category which I said, if you fulfill that criteria, then naturally a surgeon will take you up for surgery. Then you should not be having any systemic diseases, like if you got some heart problem, kidney problem, lung problem, then we say ki wait, don't go for cosmetic. First you get yourself cured of the diseases, because once you are cured of the diseases, you are a good candidate for anesthesia also, because there are a lot of complications with anesthesia in case you have got cardiac problem, lung problem, liver problem, etc. So you should be physically fit. I always feel that a patient of cosmetic surgery should be physically fit at this young age, and then only they should contemplate any cosmetic surgery for nose or any other part of the body. And now one of the most important thing, whether you got any functional problem. Now if you got any breathing difficulty and you have got a deviated nasal septum, or your nasal walls are not working properly, then also a cosmetic surgeon can improve the functionality. He can do spreader grafts, or or he can correct your deviated septum so that your breathing improves considerably. And breathing actually is, I think, one of the most important things I should say. So if you got any breathing problem because of your nose, then you must get it done, rhinoplasty. There's no doubt about that. And last but not the least, suppose you have already undergone cosmetic surgery, rhinoplasty, and you are not happy with that, then you should go for revision rhinoplasty. You can go for revision rhinoplasty because something is still nagging your mind and you think that you have not achieved the result which you deserved. So consult your doctor again and ask him whether he can improve upon that. And if he feels that yes, revision rhinoplasty will improve you further, or he can improve it further, then also you can go for it. So I think this was the last point, but it is a very important point, because at the end of the day, I think one should be very happy with his or her looks and whatever he has got, but whatever science can also provide you, that also you can encash upon that also. So now I'm concluding the topic here, and if you got any questions regarding this, please feel free to contact my team, and we'll be very happy to answer any of your questions. And if you like the video, please subscribe to it. Thank you very much.